Now, some scientists believe that the Omicron variant may be driving the rise in the number of cases. And there is also speculation that Gauteng is already in the fourth wave of the COVID-19 infections. But as we've heard in the briefing that just happened with the Gauteng coronavirus cases, we will officially be into the fourth wave, perhaps around 2 weeks' time. But we have been advised to conduct ourselves as if we already were in the fourth wave. Now let's take a closer look at this situation and how those who are on the ground are actually dealing with it. And for this conversation, I'm joined by Simphiwe Gada, who is the Gauteng Chairperson of the Democratic Nursing Organization of South Africa, DENOSA. A very good afternoon to you, Mr. Gada, and good to have you with us. What are your thoughts after hearing the delivery and the presentation by the Gauteng Command Council? What they expressed, is it what you and the nurses on the ground have been seeing and experiencing?
Well, thank you for having us, and good afternoon to the viewers of Newzroom 45. Well, Tammy, last week Friday we issued a statement where we're expressing similar sentiments as DENOSA, that we are worried, and what worried us the most was the fact that if you look at the public-private partnerships in terms of vaccination, about 40 to 50% of them have shut down, and then about 30 to 40% of the public sector vaccination sites have shut down. This tells us that people are more reluctant to taking the vaccine. Now, over the last 2 days since the president spoke on Sunday, we have seen a slight low appetite for taking the vaccine. So we were worried that we might enter the fourth wave sooner as Gauteng than the rest of South Africa. And our worry was to encourage people to take the vaccine, because when you take the vaccine, we slow down the pace of infection or the rate of infection. So when we go on the ground, we do see that beds are starting to fill up, and we are starting to see patients being admitted in hospitals for the treatment of COVID-19. And that worries us a lot. And that is why the call that we continue to make is that people must make use of the vaccination sites, because, Tammy, when government was not responding adequately or was moving at a slow pace in procuring the COVID-19 vaccines, the whole nation was complaining, saying that our government is telling us to wash hands and sanitize instead of getting us the vaccine. Now that the vaccine is here, people are reluctant to vaccinate. And the other worry that we have is that we may have stock that may expire because it's just sitting unutilized due to the low numbers of vaccine uptake by the citizens. So, and our worry is that the healthcare workers are fatigued. You recall that since the first wave, we've been working and prioritizing South Africans, and at the expense of other diseases, because HIV and TB have not actually taken leave. They are still with us, and we seem to be focusing more on COVID-19, which we think that in the future we'll begin to experience the consequences of doing that in the health sector, but also in the economy. And people need to understand that the call for vaccination is also linked at saving jobs, building the economy, and ensuring that the nation proceeds in terms of reaching its herd immunity.
You know, Mr. Gada, you spoke about something quite important there, mentioning the fact that as healthcare workers, as frontline workers, you have been at the forefront of this COVID-19 pandemic, fighting it right from the start. What are the levels of fatigue? Has there been a break for nurses to get a little bit of a breather and recuperate for the next waves? Or has the pressure been sustained throughout?
The pressure has been sustained throughout, because as and when it is announced that the infection rate is dropping, we then begin to see a lot of people having super spreader events, and at the end of the day, they come to the facilities. We see a lot of people using alcohol recklessly, and at the end of the day, they get involved in all the social crimes such as, fighting, accidents and all that. And all those things continue to put a burden on the healthcare system. So we have not had time, to actually implement, the planned leave and all those things. Because in fact, our oath binds us that we must always put the patients first before anything else. So health workers have not had the time to rest, because in between looking after patients in the ward, we were also expected to drive, remember the vaccination drive is also dependent on nurses especially. So the nursing profession has been overstretched in that we have to run clinics, we have to run hospitals, the wards, and also ensure that the strategy of government in terms of achieving its targets is mainly reliant on nurses. So we have always had pressure, and we continue to experience a lot of pressure and fatigue.
What is the current status of availability of protective gear?
Well, in that regard, we do have PPE, because what we have also experienced is that we have begun to see a lot of PPE that is procured locally and produced locally, which we commend, because that is a positive injection into the economy, and it's also boosting small business. So we've seen a lot of appetite from small businesses that continue. Some are manufacturing the PPE. So we don't have much of complaints around PPE. The only thing that is not assisting us, and which I must put it out clearly, that disgusts us as the nursing profession or as on behalf of healthcare workers, is the fact that since the scandal of PPE broke out, we are unable to even name one person that has been convicted, and we feel shortchanged as healthcare workers in that money that was allocated for our safety was recklessly spent. But the president of the country, together with the head of the NPA, Shamila Pato, we cannot even present one individual that they have successfully prosecuted. So we feel that much as we have, given ourselves to the fight of nation building and protecting the nation, somewhere, somehow, the authorities are failing us. Government in this regard is failing us in showing its strong hand in terms of opposing corruption. So corruption continues to threaten the lives of South Africans, and that is something that we find difficult to tolerate. We don't tolerate it, we condemn it. We call on the President, Shamila Pato, to actually present to us. We challenge them to present to us cases and tell us who has been convicted. We think that they owe health workers that much.
What are the lessons that have been learned from the first wave to the now looming fourth wave for healthcare workers? Perhaps this time has given you the opportunity to see where the gaps in the system are, and what recommendations have you already given to government and the health department on how they can better deal with COVID-19 and hospitalizations?
Well, as health workers, we are now far more experienced now in terms of, dealing with COVID-19 patients and managing them without compromising our own lives. We can now nurse those patients. We know that scientifically PPE has proven to protect us, because we go into these COVID-19 wards, and we also, after knocking off, we mix with our families, and we continue to test negative. But what has also assisted is us getting the jab. That is why we continue to stress the importance of the jab. And what we have put forward to government is that we must ensure that the issue of bed capacity does not become a challenge. The issue of availability of PPE does not become a challenge. And also, being proactive in our planning is also assisting us in terms of managing, these COVID cases. So these are things that we continue to push, and as we move forward, we continue to have more and more experience. So I think we are now, I can say that we are slightly better prepared than we were in the first wave, and we know what to do now. We know how to treat patients. We know what information to give, because one of the major focuses that we strongly rely on is that we need to make sure that we encourage people to avoid, getting infected through stressing the non-pharmacological use of preventing COVID. So we now know what to do. Unlike before, we didn't know what to do. We've got committees that are in place in the workplace. We're able to deal with patients as they come from the screening, triage, and all that. So I can say that we have learned a lot in the past couple of months while we're dealing with COVID-19.
And I wonder, Mr. Gada, what is the current general view from nurses as far as vaccination is concerned? Have all of them been vaccinated? Are you looking forward to the booster shot? What are your sentiments regarding that for yourselves as a fraternity?
Well, there's a positive outlook in terms of receiving the vaccine. Majority of healthcare workers have taken the vaccine, though we still have, those who still have certain reservations about the vaccine. And that is caused by the fact that while we continue to preach a positive message about the vaccine, there are people who are hard at work, dealing with propaganda and doing all the goods that we have done in terms of encouraging our colleagues. I mean, I myself, for instance, I was one of those that was a bit hesitant, but upon, extensive research and understanding and seeing my colleagues having taken it, I then decided to take it. And today I can proudly announce that I'm fully vaxxed. And I encourage more healthcare workers to take the vaccine because it will assist us in terms of ensuring that we don't have a large number of people pouring into our hospitals, because the vaccine assists in managing the aggressiveness of COVID-19, and you can be able to heal safely at home. So they continue to take the booster shots.
Mr. Simphiwe Gada, thank you very much for your time, as well as giving us, the experience on the ground. He is the chairperson for the Gauteng leg of the Democratic Nursing Organization of South Africa, DENOSA.